Let's keep the medical thing going. It's considered the gold standard in skin care treatment. And here to explain, we turn to Dr. Jorge Garcia from Apex Skin. He's the founder of Apex Skin. It's great to see you, sir. And we're talking about a little surgical procedure here to save people a lot of problems with skin cancer, right?
Yeah, good morning, Dave. Thanks for having me. Yeah, we at Apex Dermatology, we are all about giving the patient the best treatment. So we have the procedure called Mohs micrographic surgery for skin cancer, who treats really most common skin cancers in the office.
Okay, so when somebody has a spot on their skin or something, they should be able to identify it, or they come see you and you identify it, and then you tell them what to do.
Usually the patient comes in with a spot that's bleeding or changing. We do a small biopsy of the skin to make sure that we diagnose it. Once we have a diagnosis of a skin cancer that's non-melanoma, then we utilize the Mohs surgery procedure for most things, especially in the head and neck or the back if they're big. And it's a procedure we do everything in the office. We check the margins while the patient waits, and it's a very patient-friendly procedure.
Let's tell people how it works. I actually had it one time, and when I heard what was going to happen, I was like, well, I was a little on the edge. But then, once he explained it, it's a very delicate but painless procedure, isn't it?
Yes, we basically numb the patient up in the office, just like when you go to the dentist. We take a little scalpel and take a very small a very small rim of the tissue, and we take it to our lab. We have a lab in the office checking. We check the entire periphery and the deep edge of the cancer and make sure we get it all out. And then if it's still positive after the first pass, we microscopically chase it. So we go a little bit at a time. The whole point of Mohs is to conserve as much normal skin, but at the same time, 99% cure rate if done right.
Yeah, I think that's the best thing about it. I mean, it's not just somebody just taking a big chunk out of you. It's just like taking as little as possible. And you could actually, you could sit in the office and actually go through the procedure like 2 or 3 times and then come away with not much of a mark on you.
Yeah, usually, I would say most people with 2 layers. Like I said, we minimize the normal skin that we remove on your face, especially in sensitive locations like the nose or the ears. And then we do usually the reconstruction right away in the same day, or sometimes we have the patient have, Mother Nature heal it. It's a very easy procedure on the patient. It's covered by insurance. And really what's most important for me to tell patients is that if you get a skin spot, get it checked. But if you have skin cancer, don't delay treatment, especially with COVID. We've seen a lot of bigger, larger, high-risk cancers being left untreated. And, experience counts when it comes to skin cancer. So at Apex, we've done over 50,000 of these Mohs procedures just between Dr. Killiam and I. So you're in good hands with us.
So you have Dr. Killiam also. How many different Apex centers are there?
We have 10 locations. We cover all the way from Ashtabula to Canton to Westlake. So come see us if you have a skin check. Don't delay it.
Hey, so you're one of the founders, and it's a very interesting story. You were a surgeon in the Navy, and how did you decide to come to Northeast Ohio and put this clinic system together?
Yeah, I was a flight surgeon with the Marines before I did dermatology. I'm very proud of that, my military service. Cleveland is my home now. I did all my training here, and now I have my family here. So this is, we're Cleveland people, and we're all in with Cleveland.
Hey, I have a question for you. Like, when you see things on your skin, is it easier to determine or discover them in the winter when you're not tan and your skin is whiter? Is it easy to find stuff this time of year?
A lot of times it's easier because people don't have a lot of the sun damage. But I can tell you that, skin cancer happens all the time. People just need to be vigilant. Be skin smart. Check your skin. Look for things that are changing, that are bleeding, that are crusting. And, don't delay it. In our offices, we have strict guidelines for PPE and, making sure that we screen everybody that comes in. It's a very safe environment. And, the most important thing, I can't stress this enough, don't delay your skin screenings because of COVID. Right now, with the vaccine rolling out, it's important to keep track of skin screenings or any other skin type of cancer screening available.
And one thing I know about Apex also, if you call for an appointment, you're going to get an appointment right away. It's not like, some places you call and say, well, we'll see you in June.
Right. Well, listen, for us, that's our value proposition, same-day appointments. We have our Apex Spot Check program, which guarantees you an appointment same day or next day if you have a new lesion. That's what we're all about. I mean, we want to get people in. We're partnered with our communities to make sure that, people know that we're there. We do skin screenings. So, come see us. Don't get nervous about the examination. It's pretty straightforward. We have terrific providers, and we make it really patient friendly.
And it's really good sometimes when you go there to say, oh, no, it's nothing. Don't worry about it. I like that diagnosis, too.
Yeah, that's my favorite part, yes.
Dr. Jorge Garcia, great to see you at Apex Skin Centers. Check them out. Wonderful spot.